Welcome to dissection of sheep kidney. To begin with the dissection, I need to observe safety protocols. So I have my PPE done, I have my gloves, I have my apron, and then I have my goggle. I also have my dissection kit, and then I have my dissection tray and my spaceman. My spaceman is a coronal perfect solution sheep kidney. So now I will place the spaceman onto the dissection tray and identify the external and internal structure. So when you take the kidney, the external surface is covered by renal capsule. The renal capsule is dense connective tissue that protects the kidney and also give it shape. Now when you turn it, we have the depression where the renal artery, the renal vein, and the ureter enter and exit the kidney, and that is called the renal harris or harris. Now we have the ureter. This is the ureter. So the ureter extends from the kidney to the urinary bladder. Then we have the renal artery and then renal vein. It is difficult to differentiate among them because it has been detached from the animal. But the renal artery, assuming that this is the renal artery supplies the kidney with oxygenated blood. Then the renal vein is a blood vessel existing from the kidney with filtered deoxygenated blood to the inferior vena cava. So that is the external surface of the kidney. Now let's look into the internal structures. So before you do that, you need to bisect. So we have already done the bisection to save us time. Now, with the internal structure, we have the renal cortex, which extends from here to this place. But before that, we have also indicated that this external surface here is the renal capsule. So you can just feel the small here. Then from there, we have the renal cortex between this place and that place. Beneath that, we have the renal medulla. From here to here is the renal medulla. Within the renal medulla, we have the renal pyramid. The pyramid is a cone-shaped structure found within the medulla. So we have one here, so we have the tip here, the base. We have another one here, the pyramid. Then there's another one here. Of course, there's another one here too. Between the two pyramids, we have the renal column. So here will be the renal column. There's another renal column here. Now, the renal pyramid together with the adjacent column and then the portion of the renal cortex at the base of the pyramid together forms what we call the renal loop. The renal loop is where the urine production occurs. From the renal loop, the urine passes through the column to the minor calyces. So we have the minor calyces here. Then the urine passes through from the minor calyces to the major calyces. The major calyces is several minor calyces that are merged to form the major calyces. So the urine then passes through the major calyces to the renal pelvis, and then through the renal pelvis pass through the harus, then to the urethra and to the urinary bladder. So basically, these are the structures of the kidney, of course, the sheep kidney that we use. Thank you.